So tell me, what brings you in today?
I'm having a hard time breathing, and I am tired all the time. And just look at my eyes, drooping.
Well, this sounds a lot like myesthenia gravis, which is an autoimmune disorder. There's a test that we can do to see if that's really what you have.
What kind of test?
Well, it's called the tensilon test, and what I'm going to do is give you a little shot. And then we're going to recheck you in about 5 minutes to see if any of your symptoms get better. We will also use this test if you are already diagnosed with myasthenia gravis to tell us if you're taking too much of your medication and your body's in a crisis state. In this case, we wouldn't expect to see any improvement of symptoms, but for today's test, we definitely expect your symptoms to improve if you actually have it. Cut! 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 I'm the director. Quiet on the set. Listen up. Do you want to pass Cindy's test? If so, here's what you need to know. This is what we've learned so far. Myasthenia gravis is an autoimmune disorder where you get fatigue and you get a droopy face and your eye might droop and you get some weakened muscles. To test for this, we do the tensilon test, which gives just enough meds to make the symptoms temporarily disappear. And now, back to our show. Well, your test was positive, so here's the doctor to explain to you what your symptoms are.
Yep, you've got MG all right. Now lay down and I will split your sternum and take out your thymus.
Wait a minute, doctor. Just a moment. Our client does have other options. Well, if you think surgery is best, that's all right, but we could go through the cervical region and then we don't have to split the sternum wide open.
Well, I probably won't make as much money then, but if you insist.
I'm not ready to have surgery. Is there any other option?
There goes my new sports car. Patients always want the cheapest option that doesn't cut them open.
Yes, patient, there is another option. What we can do is give you some prednisone, which is a steroid. That should help to improve your muscle strength. And we also give you acetylcholinesterase. This will help to break down the extra acetylcholine that's causing your symptoms. Another thing we can do is exchange some of your plasma. This will get rid of some of the extra receptor sites for the acetylcholine.
I will go write the orders. I guess you don't need me anymore. Call me when you are ready for me to cut out the thymus.
Here's the orders. And here's what I'll be doing. I'm going to be keeping an eye on you. And what I'm watching for is to make sure you have a clear airway and that you're able to swallow good. If later you think surgery is the best option and you opt for that, we can do some chest tubes. And at that point, a tracheostomy is quite likely. Cut! Everybody, cut! Nice job. Quiet on the set and listen up. These ladies are going to give you a quick recap of everything you need to know about myasthenia gravis.
So how'd that